Welcome to our latest edition of Board in Brief. I'm Patrick Vernon, the Chair of NHS Birmingham and Solihull Integrated Care Board. In this edition of Board in Brief, I'll be sharing an update on urgent and emergency care and an update on learning gained from last year's measles outbreak in Birmingham and Solihull. Firstly, urgent and emergency care. Urgent and emergency care and winter are a big priority for us as an integrated care system. And the challenge for local services have been significant over the last several weeks. This can be seen in a range of factors, including the number of ambulances and length of those ambulances waiting outside accident and emergency hospital departments, the time people are waiting within A&E departments, the fact that across the whole system our beds are almost at full capacity, and the number of patients who are medically fit for discharge within an acute setting. These factors are impact on both patient experience and on staff working within urgent and emergency care settings, which are run to full capacity. We are focused on what more we can do to ease this pressure, improve patient flow, and also increase bed capacity. We also need to recognise the tremendous efforts of many of the staff across our system, both clinical and non-clinical, who are striving to improve this situation. Our work as a system is focused on 4 broad areas to improve urgent and emergency care. These are areas where we feel we can make the greatest difference to patients and to our staff. First area is admission avoidance. Secondly, open additional capacity and ensure that we are utilising this in the right way. Thirdly, enhancing discharge. And fourthly, improving our mental health urgent care. The second update I'd like to share with you is learning from the measles outbreak that occurred in Birmingham and Solihull at the end of last year. At board, we heard from our ICB's Chief Medical Officer, Dr. Clara Day, and Ruth Tennant, who's the Director of Public Health at Solihull Metropolitan Council. Clara and Ruth shared with us the lessons learnt from the measles outbreak, which began at the end of last year. Our response to the outbreak took a population health management approach by being collective, data-driven, and targeting those at the greatest need and always seeking to improve. In Birmingham and Solihull, our vaccine uptake is lower than the national average and quite varied between different communities. We are clear that immunisation and vaccinations are critical for us to protect our citizens from serious illness, and the measles vaccination does provide very good protection. Our approach was to protect people, contain the infection, and lastly promote to our communities using outreach, engagement and communications. For our efforts across 5 teams, which were focused on different disciplines, from delivering the vaccine to communication, we saw an increase in vaccinations from the first dose for under 5-year-olds, catch-up vaccinations for 6 to 25-year-olds. Critically, at board, we were discussing the measles outbreak and to see what lessons we learned from applying to other programmes. During the outbreak, we utilised very strong partnership that existed in Birmingham and Solihull. We had a robust system leadership model, and we were able to be agile and to deal with the uncertainty well. It is essential that we learn from all our experiences with measles and we can apply this learning elsewhere. We have recently launched our Breathe Easy campaign, encouraging people to breathe easy by getting the best protection against respiratory illnesses through immunisation for flu, COVID-19 and RSV. Please scan the QR code on the screen to learn more about how you and your loved ones can get protected.